Good evening, everyone. I am Dr. Aarti Sharma, and today I will be discussing about the rheumatologist perspective for chronic pelvic pain. Chronic pelvic pain is being described as a pain which is usually felt between a belly button and between the hips, and we say it is chronic when it lasts more than 6 months or more. So there are multiple causes of chronic pelvic pain since multiple organs are there in the pelvic area, but I will be focusing on my side, that is the musculoskeletal causes of chronic pelvic pain. So when we talk about pelvis, there are multiple joints, muscles, fascia, and multiple other things involved in that particular region, which can be a cause of musculoskeletal pelvic pain. So we will start with the joints first. We have lumbosacral joint over there. We have sacroiliac joint. We have multiple sacral and coccygeal joints as well. We have hip joint in that particular area. So it can be due to the involvement of sacroiliac joint, which is sacroiliitis, which is a common feature in the patient of spondyloarthritis, or commonly known or better known as ankylosing spondylitis. Similarly, the hip arthritis can be a cause of pelvic pain, which is again a feature of spondyloarthritis. Then we have enthesial sites pain as well. So we call enthesis is the point or the area where there is an attachment of a tendon, muscle, or a ligament. In the pelvic area, we have anterior and the posterior superior iliac spine. Ischial tuberosity is there, iliac crest, and pubic symphysis. These are the common enthesial sites of pain in the pelvic area. And enthesitis is usually seen in the patients who have a history of psoriasis or psoriatic arthritis, or the patient of spondyloarthritis. Similarly, we have degenerative causes of joint involvement in the pelvic area, which is osteoarthritis, which have subtle component of inflammation in it as well. Other cause is AVN, which is the avascular necrosis of the hip or other joint. Most commonly it is seen in the hip, and it can be because of the overuse of a particular medication like the steroids, or can be because of the toxic intake of alcohol as well. Impingement syndromes are well known, and this can be because of the impingement of the nerve at a particular site because of the involved joint or the muscle. So besides joints, we have muscles with us, which is myositis, which is the inflammatory myositis, rather I should say. And the patient will complain of pain in the particular muscles, especially in the morning hours. Then we have fasciitis, which is the involvement of the fascia, the inflammatory involvement of the fascia, which is usually seen in association with the myositis. Then there are vascular causes as well for the involvement of the pain. We have vasculitis condition in which patient will complain of claudication, which means the patient will have pain while walking for a few meters or the kilometers, and the patient will have relief in the symptoms after taking 5 to 10 minutes of rest. So this is one of the mechanical cause of pain, rather I would say, in contrast to other inflammatory causes of pain. Then if the spine involvement is there, which is commonly seen, which is spondylitis, again a feature of spondyloarthritis, or a coccygeal pain is there, which is commonly seen over there. These are the causes of inflammatory pelvic area pain. So going to the basics, the gold standard is always a history taking and a clinical examination. So a good history taking is very important because in all the causes which I have just enumerated, the important is history, where the intensity of the pain should be highest in the morning. And this highest intensity of pain is accompanied by the early morning stiffness, which is lasting for 1 or more hours. So once we clinch over to the diagnosis or the location of the pain, be it the arthritis or the enthesial involvement, then we can also make a diagnosis, and we can order the relevant investigations, which can be blood investigations or the imaging ones, to make a diagnosis and the further treatment. One most important cause of pain I would like to discuss over here is myofascial pain syndrome, where the patient has multiple trigger points. If you ask the patient where the pain is, the patient will pinpoint at a particular thing. So if you will palpate that particular point, the patient will have immense pain. And with these trigger points, patient is usually having associated sensory or autonomic symptoms. So with these 5 minutes, I would like to conclude that we should never ever forget about the musculoskeletal involvement of the pelvic area. And the 2 important points are early morning stiffness lasting for 1 or more hours. And second is the intensity of the pain being highest in the morning. Thank you.